Dr. Brandon Money, the golf doctor, here to discuss number 5 of the top 5 golf shoulder injuries. At number 5, we have frozen shoulder. Frozen shoulder is also known in the medical community as adhesive capsulitis, and it is characterized by a few different factors, including stiffness in the shoulder joint, reduced range of motion, and associated pain in the shoulder. It affects 2 to 5% of the general population, which here in the United States averages out to be about 10 million people, and it is most common in individuals aged 40 to 60 years old. And a little bit on the anatomy of the frozen shoulder. The shoulder itself is a ball and socket joint that's formed by the humeral head, the ball, and the glenoid cavity, the socket. Now I want you to think about the shoulder as a golf ball that sits on a sideways golf tee. Now, the joint capsule and capsular ligaments help keep that ball on that tee at all times, whether we are at rest or moving the shoulder. And frozen shoulder itself involves thickening and tightening of this joint capsule and those associated ligaments, as seen in this bottom left image of this slide. Now, a little on the pathophysiology of frozen shoulder. There's typically 3 phases in the disease process. There's the initial freezing phase, which is increased pain and gradual reduction in mobility of the shoulder itself. We have the frozen phase, where there is less pain, but substantial stiffness and significant loss of range of motion. And then finally, we have the thawing phase, where we gradually return to range of motion of the shoulder. And underlying mechanisms, we have inflammation of the synovial lining of the shoulder joint itself. There's fibrosis and thickening of the joint capsule. And we have adhesions that get developed within the capsule itself. The primary cause of adhesive capsulitis, we don't really know. That's what we call in the medical community idiopathic. Some things we do know after surgery or being immobilized after an injury, and then other diseases like diabetes and thyroid conditions can predispose you to a higher likelihood of getting frozen shoulder, along with being a female, having episodes of prolonged immobility, and being between the ages of 40 and 60. Now, symptoms of frozen shoulder. Key symptom is persistent pain, which can often be worse at night. There's stiffness and limited mobility, difficulty just doing daily activities like dressing yourself, combing your hair, bathing, reaching up to the upper cabinet. The timeline associated can be very long, 1 to 3 years or more for those 3 phases to resolve without treatment. Treatment options for frozen shoulder include physical therapy, which can help with range of motion and strengthening of the muscles surrounding the shoulder, hydrodilation of the joint capsule itself, which is an injection that can help release adhesions within the joint capsule. With that, we can use orthobiologics like platelets to help with overall tissue healing. There is what's called a manipulation under anesthesia, where a surgeon will put you to sleep and then force your shoulder through those restricted movements and range of motion. And then finally, we have a surgical capsular release, where a surgeon goes in and physically cuts the adhesions away of the joint capsule. Now, some final thoughts. Frozen shoulder, it is a very long process to get back to previous function, 1 to 3 years or more. The timeline can be expedited with non-surgical methods, but surgical options are a last resort if all else fails. However, we can develop resultant shoulder instability from damaging the joint capsule and those ligaments. All right, golfers, now you know the inside about frozen shoulder. Look out for the next video coming soon, number 4 of the top 5 golf shoulder injuries.